Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left 6. This tooth seems to be considerably broken down. There's only a very limited structure above the crest of the bone. As you can see that there's an obturational material or radio opaque material within one of the canals, whereas a slight radio opaque material can be seen in the distal canal as well. On the axial view, which is the top to bottom view, we will show you that this is the region of the 5 which seems to be recently extracted. There is no bony architecture present, and we can see a huge radiolucency which is also communicating with the radiolucency of the 6. Now on the lower left 6, you can see that the mesiobuccal canal and the distal canal seem to be clear, whereas the mesiolingual canal appears to have a radio opaque material present in it. As we move more apically, we can see that there is a radio opaque material present in the region of the 5 as well, and in the distal canal as well, which is present right here. We can also see that this there is a radiolucency associated with a slight bit of a resorption that can be seen in the distal canal on the lingual aspect right here. So on the transaxial view, this is the distal canal. You can see that there is a radio opaque material right here. The canal seems to be cleared with a slight radio opaque material, which can be associated with the slight distal-lingual canal here, but otherwise the central mesial distal canal seems to be completely clear with a radiolucency associated right here. There's also a radiolucency which extends into the distal aspect, which can be viewed here. On the mesial aspect, however, we can see on the mesial root that we've got a mesiolingual canal which has a radio opaque material, and a transportation or a ledge can be seen here. The obturation material is not extending outside, but it is definitely not going all the way down. Here you can see that this is the canal architecture right here, and the radio opaque material is stuck in the ledge here. The mesiobuccal canal seems to be cleared all the way to the apex, but this is the radiolucency, and this radiolucency extends all the way into the extraction socket of the 5 as well. So if there are any further questions, please feel free to reach to our team. We would be more than happy to help. So this is another view that we can show our doctor right here. So this is the view right here. So here you can see on the sagittal view that there is a slight radio opaque material. This radiolucency is extending from the 5, extraction socket of the 5, all the way to the mesial root of the lower left 6. This is where the transportation is done. However, this is where the canal morphology is taking all the way to the apex. So this is the distal canal. This is the mesiobuccal canal, which is also transporting into the radiolucent area right here. There is no interradicular radiolucency or furcation involved, but the transportation of the mesiobuccal canal is quite evident in this region, where you can see right here. So this is the transportation that can be seen here, that it extends into the radiolucency. Both the canals, mesial, mesiobuccal and mesiolingual, show transportation which is visible on this sagittal view. Thank you very much.